this Monday, November the 23rd, all Denver DMV branches will be closed to in-person services until further notice. And in-person service at our Taxpayer Service Center will be reduced to 2 days a week as well. The services offered by these two operations will still be available for residents to access online at denvergov.org. We're shifting these two services back to a more virtual setting as part of our own efforts to reduce the number of places where people can gather and potentially spread the virus to one another. Across the nation, the third wave of the pandemic is unlike anything we've experienced before. It was predictable, however. The absence of a coordinated national response on nearly every aspect of this pandemic is forcing states, counties, and cities to act on their own. And the utter failure and refusal of Congress to help is simply shameful. At a time of national crises, with lives and livelihoods at stake, the fact that some elected officials are chasing conspiracy theories about the election, undermining democracy, still debating the usefulness of masks is simply appalling to me. This morning, I was watching the news, of course, in national news, and I watched as a nurse put this in proper perspective. Would you rather wear a mask or have a tube put down your throat? And that's really where we are today. COVID-19 is surging across the entire country at an alarming pace, more than 100,000 new cases a day for over 2 weeks now. Nearly 80,000 people hospitalized with COVID, a rising death toll, and a national positivity rate that now exceeds 10%. With our numbers, while our numbers have also been spiking here in Colorado and Denver, we continue to be proactive. You saw on Tuesday, Denver and several other metro area counties received the official notice from the state that we have been moved to the new red level on the state's updated dial system. This was unwelcome news, but we understand what the governor and state officials are trying to do, and that is curb infections and save lives and protect an already stressed healthcare system from imploding, a circumstance that would have catastrophic impacts on our community. The enhanced restrictions for this new level go into effect at 5 p.m. today and will be in place at least until the week that ends on December the 18th. To remind everyone of some of the new capacity restrictions that will be in place. One, office spaces should be down to 10% capacity for on-site employees. And we are encouraging as many people as possible to work from home during this time. Indoor dining at restaurants is temporarily closed. Restaurants can continue to offer outdoor patio seating with a 8 p.m. last call, as well as a curbside pickup and delivery. Retail stores can continue to operate, but they must be at 50% capacity. This is good because I know a lot of folks want to do some holiday shopping. Speaking of the holidays, Thanksgiving is now less than a week away, and I've told you all the last time we got together about the gathering of 50 family members and close friends at the Hancock household and how it's going to look different this year. We're going to be doing a Zoom so that we can at least see each other on Thanksgiving. So please, I urge everyone, maybe get a small turkey this year and celebrate with just those you live with. And after the meal, as we're going to do, Zoom with your extended family, all your friends, everyone that you meet, and tell them that you look forward to seeing them real soon. And that maybe next year we can all be together again. I know this is hard. I know you hate this. I hate this. But we are doing our best to avoid a complete shutdown of our economy. And as our governor put it the other day, a catastrophic breach of our hospital system. We are trying our very best to protect lives and to protect livelihoods. I'm asking, I'm urging, I'm pleading with everyone. Please stay home. Please only go out for essential services. Stay home, maybe put up holiday decorations, but stay home. With more good news about the second possible vaccine coming on this week, we've got some hope, but we're all about to enter the hardest phase of the pandemic. If this virus continues to spread like it is right now, it won't just mean another stay-at-home order. It will mean more easily preventable loss of life. It will also mean further devastation to our economy and people's livelihoods, creating another easily preventable health crisis. We know our local businesses are being hit especially hard right now. With the governor calling a special session of the legislature, some additional relief will be coming from the state. And we will continue to look for ways to provide financial relief for our local businesses here in Denver so they can keep their doors open and employees employed. I want to thank the members of the Denver Economic Relief and Recovery Council who have been by our side since day one, providing guidance, recommendations, and a clear pathway or clear pathways to help support our businesses and nonprofits across the city. To date, we have provided nearly $10 million in COVID relief grants to some 1,760 small businesses and another $2 million to nonprofits. This includes 614 small business grants totaling over $3 million awarded just last week. $4 million more will be dispersed to both small businesses and nonprofits by the end of the year. The City and County of Denver will again be waiving the 15% penalty for late payments for sales and use and occupational privilege and seat taxes for November. Those taxes would be due on December 20th, 2020. The city is also partnering with Shop Sidewalk to bring free technical support and locally focused e-commerce platform to independent small brick and mortar retail businesses. The platform is designed to help local customers find and buy products from local stores in close proximity to their neighborhood. I also directed both the city finance department and the economic development teams to explore additional relief we can provide to local businesses and workers to ease the burden of these additional capacity restrictions. We can get through this, and we can do what we need to do to prevent further spread of the virus. For the next few weeks, we need everyone to stay home and stay safe as much as possible. It's going to be tough, but we must bring these numbers back down, and we can do that if everyone works together. I'm now going to turn it over to Bob, who will give you further updates on our public health orders and our operations. Bob?
Yeah, thank you, Mayor. Thanks everyone for joining us this morning. I hope you're doing well. I'm going to go through just a few slides here, and then we will open it up for discussion. Hopefully this is visible on everybody's screen. I want to start out just by sharing that this is what the national landscape looks like, and this was as a couple of days ago. California and some of the eastern states, I believe, have now moved into the red category. So nationally, we have some real work to do and some real coordination at that level. When we bring it closer to home here, you see what's happening throughout Colorado. We have many counties that are where Denver is. 20 counties or so moved into the red when Denver did. So I certainly appreciate the mayor's support in moving in that direction. I think it's the right decision to make, and hopefully it's going to get us out of this sooner. The state health department will be working with many of these counties here to move them into the red, where the metro areas and some of the rural counties here. When you look at our EpiCurve, I know everybody's familiar with this, and it just continues to spike. You take a look at this last tail end here again, that's just delayed reporting here. Numbers continue to go up. And when you look at the hospitalization rate, the last time we got together to give an update, this last category, or this last metric down here on the bottom, was in the green. Just yesterday, statewide, I believe there were 90 additional people that moved, that were admitted to hospitals. and regionally, about 60 of those were regional admissions. So hospitals continue to struggle. It's not just a matter of space and equipment. It's a matter of staffing too. So we need to do everything we can to pull together to help out our hospital systems and our medical care providers. The mayor touched on much of this already. No personal gatherings, that's anywhere at this point. And if we do this for the next 30 days, I'm very hopeful that we're going to see this start to turn in the other direction. You can see the restrictions there, 10% in offices and gyms and retail, both critical and non-critical at 50%. And then restaurants, again, no indoor dining. Outdoor dining is still allowed. You can see there's some restrictions on alcohol sales there. All indoor events will be closed during the duration of this order. We know that indoor settings are more risky, although outdoor settings, spread still can occur. So remember, with face covering or the Denver's face covering order, if you are indoors by yourself, you don't need to wear one. If you're indoors with your household members, don't need to wear one. If you're outdoors by yourself, again, you don't need to wear one. But if you are outdoors with anyone else that is not inside your household, we need you to wear those face coverings. That is a proven strategy. Outdoor events, you can see there are additional restrictions there in terms of capacity, the number of people. You know, even though the cases have gone up, the strategies are proven. They work. And so if we all do these things that are listed here, in addition to those things that are in this order, we're going to get through this. I'm confident that we'll see the epi curve start to trend in a positive direction. I do want to point out here, and I've offered this up before, that there's a new app that's been rolled out. Please download that to your phone. Doesn't matter if you have an iPhone, Apple phone, or a Android. This works. I have it downloaded on my phone, and if I come in close contact, if I've been in close contact with somebody who's recently been tested positive, I will receive a notification on my phone, and then I can consult with my medical care provider. I can be aware, watch out for symptoms, take what I need, do what I need to do to keep others from being exposed. Please reach out if you are exposed and you need guidance. You can reach out to the department here, Public Health and Environment. I want to talk a little bit about community testing sites. Once again, when we stood down Pepsi Center, we knew that we needed to engage more in community settings to get at our underserved populations and people of color, because we know that they're disproportionately impacted. And we have done that. We've moved into these sites, and we've seen a 40% increase with testing of people who identify as Latinx, and a threefold increase in testing with people that identify as being Black. Ruby Hill Park will be opening on the 23rd, and we're hoping that'll offload some of the concerns that have been surrounding Paco Sanchez Park and the wait times there. I want to stress that as we move into next week, as we stand up Ruby Hill Park, we'll be moving some resources around that'll affect some of the days and times that these sites are open. So again, before you go down to get tested, particularly next week as we make this transition with Ruby Hill, please check our website to see if the sites are open. It's best to check as soon as just before you go, because sometimes in the past we've had to close it for high wind problems and that sort of thing, and cold weather and snow and what have you. So please check before you go. I want to spend a little bit more time here as we talk about vaccines, but I'll be brief here. There's been a lot of concern about how quickly this vaccine that we're hearing about, these two vaccines that are over 90% effective, how could they do that so quickly? And I want to explain that so people understand it, because what gets us through the next few rough months is face coverings and physical distancing. That's our vaccine now. What gets us out of this pandemic is people getting the vaccine. And that's going to start rolling out here in the next month or so. But I get a lot of questions about how could that have been done so quickly in 9 months? Is it safe? When we talk about COVID-19, COVID-19 is the name of the illness that this virus causes. but researchers call this virus SARS-CoV-2. SARS meaning severe acute respiratory syndrome. CoV-2 meaning that it's a coronavirus, but kind of a part 2, if you will. My point to this is that SARS-CoV-2 is a very close cousin to severe acute respiratory syndrome. And so when we saw SARS a number of years ago, scientists were already working on a vaccine for that. So when we saw COVID-19 come to Denver and to the state back in March, and across the world, researchers didn't have to start over with trying to develop a vaccine for this, because they picked up where they had left off with the development of a vaccine for SARS-CoV-2. So I'm confident when this rolls out that this will be effective, it'll be safe, and as we move forward in giving our updates, we'll keep you posted on that. And recent research also indicates that there is perhaps long-term immunity once infected by COVID-2. We're gonna by COVID-19. We're gonna keep our eye on this and keep providing updates. To the mayor's point, we're in for a few rough months here, but I see the light at the end of the tunnel here. We pull together, we wear our face coverings, we physically distance. Vaccine starts to get distributed to high-risk individuals, perhaps starting as early as next month. And as that continues to be distributed throughout our communities, I see 2021 looking a lot different than where we are right now. So with that, I will open it up to, I guess, turn it back to you, Teresa.
All right, thanks so much, Bob. Thanks, Mayor. And it is time for Q&A. If we have press on the line and you have a question, go ahead. Any questions?
Hi,
Hey, Bob, this is Conrad. Oh,
Vinny,
sorry,
go
ahead,
Go ahead, Conrad.
Vinny, go ahead.
Conrad. You go first.
Vinny, let's go start with you, Vinny. We'll go to Conrad next.
Okay, thank you. Sorry about that. This is Vinny Del Giudice at the Bloomberg News, Mayor. What is the status of the city's emergency services, police, fire, 911, EMS, as far as COVID infections? Are many first responders off the job because they're in quarantine or have been infected? Thank you very much.
Vinny, great question. We have had, of course, cases in each of the departments, but not to the point where we have a large percentage of them in quarantine, at least in the last reports that I've received from the Department of Director of Safety. If Murphy's on, I'll allow him to address it, but there hasn't been any alarming numbers. We did have a bit of a bump in numbers in the fire department at one particular house that we got under control and we put in measures, but nothing that will impact our ability to respond appropriately to the needs of the people.
All right, Conrad, go ahead.
And we'll get you more specific information on that as well.
Yeah, hey, thanks, guys. This is probably for Bob. I know you just talked about the need to shift to community testing sites, which does make sense. But in retrospect, with those testing sites swamped at the moment, was closing the Pepsi Center at the same time the right call? Could that be used potentially in the future to handle any influx of demand for testing?
Well, if I understand your question, what was it the right time? Yeah, I believe it was the right time. We knew that the Pepsi Center, when it was stood up, it was just standing in the gap. We needed to get testing going, get as many people tested as possible to get ahead of this. But we knew that we weren't reaching the most vulnerable people based on the data that we were collecting. I think it was absolutely the right move. We have 4 sites now set up in some of our most underserved communities. And I already reiterated the data that we're seeing in terms of those individuals that we're trying to reach are most vulnerable. Cases are up right now, and so there's a lot of demand for testing, and we're going to continue to do everything we can to get everybody tested. The state's going to step in, and they're doing this throughout the state, looking at other areas where they can contribute to the testing effort as well.
All right, thanks, Conrad. Any other questions? We have Jesse and Seth also on the line. Either of you have any questions that you'd like to ask?
All right.
Any final questions, Conrad or Vinny? Any follow-ups?
Yeah, I'd like to ask another question, if I may, of Mayor or Mr. McDonald's. As far as hospital staffing, doctors and nurses, how many of them have you gotten a rough estimate are out of work because of this situation? And what are the prospects of actually tapping the National Guard for patient care personnel versus just support personnel? Thank you very much.
Yeah, Vinny, thanks for the question. I believe there are two parts to that. I don't have the data on, the number of people in the healthcare system. What I can tell you is that it's been strenuous on them. They are fatigued. Again, so we can do our part by helping them out. They've been some real heroes every step of the way through this. But I don't have that data in front of me. In terms of calling in state or federal resources to help out with that, those are conversations that are happening with the state health department, likely a decision that would be made at that level, and we'll keep you posted as things move forward.
Thanks, Vinny. Last question. All right. Mayor, any last comments?
Thanks, everyone. Appreciate you joining us. Thank you, Teresa.